All right. Happy Tuesday, everybody.
Wow.
Thanks for coming. I am Mick Dunkey with ProPublica.
And I am Ben Jarofsky with The Reader and The Ben Jarofsky Show.
Raise fists for the Ben Jarofsky Show.
I think everybody in this room has been a guest on The Ben Jarofsky Show.
And if you haven't been yet, Ben's got a slot open tomorrow too. So just be ready.
Somebody canceled on me. Yeah. Anyway, we promised that we were going to solve the health crisis situation. I put that on Facebook, so it must be true. So we brought in two distinguished guests, and a third guest. He's not a guest, he's a host. Mick Dunkey is the creator of the Mick Dunkey theorem on healthcare, which is one of the most provocative theorems in the world. He doesn't really know he created it. He did it in a moment of what? Brilliance?
Of utter frustration with Ben Jarofsky.
Yes. So why don't you tell the people what?
Well, I think this happened last. First of all, remind everybody you're at First Tuesdays.
Oh,
Things
yes.
are coming.
Oh, here's Tim.
Yeah, you guys noticed something was different. Our sponsor and bar owner, Tim Tutton, not here tonight. So I know you were ready to go get another couple beers. You thought you had an extra 15 minutes while he warmed up, but he's not here tonight. So we're jumping right in. So this theory that Ben is talking about was just something I spat out. I said, which I do believe, which is during the debate over Medicare for all and various other similar proposals from the Democrats and people on the left, what I said last month is that I think it's a really bad idea to campaign on the idea of canceling anybody's insurance and basically saying people we're going to take away the insurance you have and then replace it with something you haven't seen. I think that whatever you think of the actual policy, I think it's a terrible idea politically, and I think that I thought that what they should be talking about is expanding rather than anything that has to do with replacing existing healthcare. So we can get into this in a moment, but let me first introduce our guests. To my left,
I'm ready to get into that.
I know, Dan is already ready. No introduction necessary. One of my dearest friends and former colleagues at the Chicago Reporter. You are the catalyst wing of the Chicago Reporter, but Dan and I have known each other for a long time. And I'd like to think I was sort of present for the creation, or at least some of the early phases of this amazing podcast that Dan not only hosts, but is the creator of and just the architect of, an arm and a leg. If you haven't checked it out yet, I hope you will after the show. Listen to Dan in person first, but where he gets into all sorts of the inanities and absurdities, sometimes the hilarious parts and the tragic parts of our current healthcare system. So I hope you'll all recognize and thank Dan Weissman for coming out.
Thank you for having
And our next guest, Barbara Otto, has been, as I understand it, has been working in this this realm for 25 years.
Nobody knows who I am. It's by chance I got here.
Of course. If you haven't figured out yet, Ben and I often grab the nearest warm body we can find to join us up here. But in this case, it's someone who actually knows what she's talking about, has been working on healthcare policy and related policies for 25 years, right?
Yes,
And
25 years.
is also, I believe, I don't want to out you, but a former journalist as well.
A former journalist, yes. I made
so-
6 months at the Milwaukee Journal-Sentinel.
That's a good run.
That's
Not bad. So before I prattle on, tell us, Barbara, a little bit more about yourself. How did you get here?
How did I get here? Like probably a lot of people in the room, show of hands. How many people have sick family members at any given point in time that got slammed with bills? My mom, and I'm not going to take the whole hour on this, but my mom was chronically ill my entire life. And I started in the corporate world. First went into journalism, then went to the corporate world, and then ended up doing community organizing. And does anybody here know single payer across the nation? SPAN? Some people in this room look like they could be spanners. We were the single payer option. Paul Wellstone and Ralph Nader convinced me to do that. during the Clinton healthcare wars. And so that's what really got me energized in healthcare. And then I started working on disability and health, and that's how I met Dan. And back then, Dan looked like Geddy Lee. He had this really awesome long haircut.
Thank God that was pre-Facebook. There's no digital versions of any of those photos that I'm aware of.
So now I have an organization called Smart Policy Works, and we are an organization that focuses on the intersection of economic and healthcare security. So we're a nonprofit, but tonight I am here as Citizen Otto. I am not here as the CEO of Smart Policy Works. So let me just get that out there.
Important distinction, yeah, because Ben in particular likes to pull you into places when you don't like to go and comment on things you're not comfortable commenting on.
Well, the great thing is I'm pretty comfortable.
All right. Okay. Dan, anything else you'd like to add? How did you end up making this podcast and getting into healthcare specifically?
Well, thanks for asking. I've been, knocking, as both a guy knocking around and as a journalist, I had my eye on the story of the price of healthcare for years. It was like, how do we get access to good health insurance was like the question that guided professional decisions in my household for many years, and some of them became very difficult decisions because of that. And as a reporter, I'd done enough talking to people and enough looking around to know that like this is everybody's story. That these stories are super dramatic. They're often life and death. They're intimate because against one of the biggest questions in our economy, in our political life. So these are like everything stories, and they're my story too. So I've been pestering employers for a long time to say like, could I do this? Seems like a really good idea. I think there's an audience for this. And the employers were all like, yeah, everybody who works here has a cool project they'd like to do. Keep doing what we're paying you to do. We'll let you know if we want you to do that. And then, the last time I left the job, I was like, well, I was kind of like, might need a new career. There's not that many other jobs for journalists, but especially living in Chicago, I was like, there's not many places to work. And then I was like, well, they're like podcasts seem like you could make one and like maybe find an audience and maybe find a way to like do this on your own. So I give it a shot. I mean, that's the honest truth. Yeah.
Well, I'd like to start off our discussion by asking, why does the current system suck?
Oh, Jesus.
You know why the current system sucks? Is it was designed by hospitals. I mean, anybody who knows their history here, Blue Cross Blue Shield, anybody familiar with that? So back in the 50s, when Truman was talking about a national healthcare system, right away the hospitals stepped in and doctors stepped in because they started thinking about losing their practices. And that's why we have the shitty healthcare we have today. It's because of Blue Cross Blue Shield.
Okay, blame them.
I just read a book that goes back. It says it goes back farther that they.
Oh no.
That in like 1918.
Oh damn.
There was. I just learned this.
Okay.
This is that book I was telling you about.
Oh,
Isn't Jill
These
Livermore?
Truths.
These
Yeah.
Truths.
Yes.
She says like there was a campaign in like the 19-teens to like create a national health plan, and the kibosh got put on it by, incumbents basically, people who had who thought they had something to lose.
Well, Blue Cross Blue Shield in the 50s was really into this employer-sponsored coverage notion because they knew that they could control costs that way, or control what costs were coming to them, right, or revenue.
So here's, why are doctors so plugged into fighting a national health care? I've never heard a really good explanation for this, because you would think, logically, that a guarantee of payment for your services, just imagine if you would, if the government said from here on out, we're gonna guarantee that every journalist got paid. I can't imagine journalists would be upset. And so, but doctors have, at least the AMA, resisted this for so long. So what's the
I think there are three big reasons. The first reason is not all doctors are created equal. There are these specialists who make a gazillion times more than primary care physicians, number one. No specialist wants to hear that they're now gonna have to take the primary care rate or a single rate. That's one reason. Another reason is that doctors are afraid that the government will tell them how to manage their patients. At least that's what they've told me over the years. And I think the third reason is they have just crazy school debt. And the thought that they would be put on a steady wage and have to manage those school loans, I think sends a lot of them over the edge. So that's why this thing is so complex. It's not a simple answer. You know, everybody's kind of coming at it from their own angle.
Now, before we go any further, are there any doctors here in the house, other than Dr. D standing over there? That's a radio show assistant, Dennis, AKA Dr. D. Are there any actual medical people in the audience? Yes?
Okay.
Okay. Do you want to weigh in on this at all?
I mean, there's a lot of debt that I have. That really scares me, but beyond that, I think like I'm not far enough along to be able to talk to the hospital side of things.
Any hospital administrators or insurance company executives?
I have a hard time believing the debt part of it, because I got a feeling that you could, if you had a national health care plan, part of it would be, could come into retiring the debt that,
Sure.
I would think that would be part and parcel of the national health care plan.
And you could do that now if you work for a community health center. You can sign up and there's a loan forgiveness and you have to work for a community health center for like a decade or something like that. But having said that, there aren't a whole lot of those slots. And it's really hard if you're, let's say, an orthopedist to get a job at a community health center. You know, really where you're wanted is in the big health systems.
All right, so before I take a deeper dive, we take a deeper dive into the politics of it. Let's talk about, Dan, talk a little bit about how insane the situation is as we set up. This is always a good setup to our inability to solve a problem. And the first part of the problem is just explaining, you know, the amount of money you're going to have to pay to get any kind of health care.
You know, does anybody need me to explain it to you? Right, so I mean, I came across a couple of statistics the other day, like today, was like a Gallup poll showed Americans borrowed, like went into debt, $88 billion. Can that possibly be right? As I say that, I'm like, that's last year, in 1 year. 45% of the adults in this Gallup poll said they thought a significant medical event would send them into bankruptcy. Okay, enough said. Right? I mean, there's more numbers, but like, whatever. Like, it's a fifth of our economy. A person I work with wrote an op-ed recently about like how many jobs would be lost if we went to single payer. And because there's all these armies of people on the health insurance side and on the hospital side, they're just there to like figure out how to game the system and like get a little more money back from the other side. And if all the people went out of work, I don't remember the exact number, but I looked it up after reading that because she didn't make this comparison. And it was the number of jobs that she was projecting, these economists she was talking about would be lost, was greater than the number of jobs that the auto bailout supposedly saved.
Right.
So there's a lot invested in the current setup.
Yeah, well, and it's like that's our it's the equivalent of the U.S. auto industry is just the people whose work does not touch a patient except to touch their pocketbook. Like that's so okay. I'll stop. Like that's enough, right?
Well, tell us one of the things you do in your podcast that makes it such a great listen is that you sort of immerse people in policy by telling stories. People call in or you get tips. Tell us one of the stories that you've covered in the show that has really struck you as like this is nuts or this is illustrative in some way, or something that you just really enjoyed looking into.
Sure. Oh, I love all my children. So today, this one came up today. I heard from a guy who's a woodworker in Chicago, doesn't have insurance. He's like, I can't afford it. Like that's a car payment, right? And like, I'm not gonna like buy a car that I don't drive, because that insurance payment would go toward a policy that has a deductible. It would mean like whatever. If I get sick, I'm screwed anyway, right? It's in the thousands of dollars that he can't afford. So he's like, I'm going with that. And as it happened during this period when he's going without, he's making a cut on the table saw, and he finishes the cut, and for everything he kind of looks away, and then he reaches to grab the offcut, and it's like the drive has stopped, but his finger gets caught in the saw. Yeah, right? I mean, like, ugh! And he's like, oh shit. And he gets his shop neighbor to drive him to urgent care. He's like, I'm not going to the ER, I can't afford that.
Urgent care?
Urgent care. Something like a clinic that's open late night,
Yeah.
minute clinic, whatever. And the doc there is like, no. Yeah, but not here. No, you have to go to the emergency room. They're probably going to amputate your finger. And it's like he's getting driven to the ER by his shop neighbor. And you know, the pain is really starting to hit. But it's not, he's like competing with the pain. And it's more pain than he's ever been in. Is the thought of like, what's this going to cost me? What's going to happen? And how long am I going to be out of work if I lose my finger? Like, what are my livelihoods? What's going to happen? Well, what happens is he gets to the ER, and the doc's like, I think I can take care of this. And it takes a couple of hours to like be able to make the stitches to stitch the end of his finger together, but he does. And he's like, well, okay, you know, good. And he's walking out, and he goes to the desk, signs some paperwork, and the desk clerk is like, hey, look, tell you what, you let me put $350 on your credit card right now. We're gonna take 60% off your final bill. Yeah, and he was like, fucking sold, you know, give it. And he was pretty happy with how it came out. And you know that we both kind of an episode from it where like, cause I kept getting other things. So like I'm on a mailing list for a kind of industry mailing list where they collect stories. And one time there was a house I was like, sit on our webinar about the patient financial crisis. I was like, that sounds good, I'll listen to that. And it was a hospital administrator addressed, like a billing administrator addressing her peers. And he was like, yeah, so, right, like most people have, an increasing number of people have deductibles with at least 3 zeros in them. We know, everybody knows that majority of Americans couldn't meet a $500 emergency expense. If I'm in the business of collecting hospital bills, that's a problem for me, right? That's a patient financial crisis, and that's my problem. That's our problem. So let me tell you what we did. We partnered with a company called Care Payment, which I realized later is like, it's like car payment with an E in the middle of it. And they're like, and it's like a car financing deal. They're like, you got a hospital, great, we're gonna set you up, no credit, doesn't hit your credit, it's cool, no money down, no interest, just make a payment plan that works for you, pay it off, it's gonna be great. And you know, they have like patient testimonials on their little YouTube channel, but like, I'm really glad we were able to pay it off with Care Payment. And you know, so this lady's like—
And what interest is Care Payment at?
Well, Care Payment gets a cut,
yeah.
Right? And it's like, great, it's great, because the hospital's like, well shoot, I just outsourced my billing operation, that's a bunch of people I'm not paying. And those people were calling people desperate to be like, Barb, when are you going to pay us the $10,000? You were like, never, I don't have $10,000 for you. That was a kind of pointless operation I was paying for you to make that call. Now I got Care Payment being like, hey Barb, what's up? Tell you what, no money down. How does $250 a month set? Could you do $250? Make it $200. How could you do that?
No.
$150. $150.
$25.
You've been paying a long time. I tell you what. Because I don't want this to go to play. I don't want this to your credit. You know, and you want to pay. I mean, so you know, I talked to the woman who runs this company, the publicly traded. She's like, look, at heart, people want to pay their bills, which is true. We all do want to.
Especially seniors.
Seniors, people who have credit ratings, people who might buy a home someday. I mean, people just feel also like I'm getting this bill. So like,
who wants this hanging over my head?
I don't want this hanging over my head. I don't want people calling me the rest of my life. Right, all that stuff. So Care Payment, that was their solution. Another story in the same little newsletter, like, oh, these hospitals are running, and I'd seen a version of this, like 50% off on old bills. 50% off. Got an old bill, bring it in, pay it off 50%. We're done. We're done here.
Do you remember when I said something about the hospitals?
Yeah, I mean, they're all. I mean, everybody's got something to lose. So I called and talked to this guy. He's super nice. He's like, I came here a couple years ago. They were like, people don't pay their bills. I was like, I come from New Mexico. It's like the poorest state in the country. People won't pay their bills if we figure out how to work with them. And so he was like, we'll try this. It totally worked, right? They were collecting the month that they tried out. They collected like 3 times the usual amount that they collect in a month, even though they were offering 50% off. Because instead of them spending their month on the phone being like, Barb, we want your $10,000. Instead, it's Barb calling me being like, I heard for $5,000 we could turn this whole thing over and be done.
Wait, so there's two messages I'm hearing here.
Yeah.
One is that you'll get the treatment even if you can't guarantee the payment, because the woodworker, he couldn't guarantee the payment.
Showed up
and
at
they
the
did
ER.
that, and they fixed his finger or his hand or
Yeah.
whatever. And the second one is that the cost of healthcare is wildly inflated. 50% off right now.
Well, I asked the guy, I was like, I mean, kind of faux naively, I was like, how can you afford to give people 50% off? And he was like, well, you know, commercial insurance gives us 60. Medicare gives us 40. Yeah, 50% is affordable, that's fine.
What do you mean the conventional healthcare gets you 60?
Like commercial healthcare, like Blue Cross pays us 60% on the dollar.
So whatever you bill,
Yeah.
Blue Cross is already negotiated, they're only gonna pay 60%
Yeah,
of that.
right.
So when you guys get your explanation of benefits, you see what they charge the insurance company, and then you see what you're supposed to pay. What they don't show us is what did the insurance company
Well, no, they
actually pay.
usually do show that.
Oh,
That's the insurance
but
company
that's-
bragging, and they're like, Barb, they wanted $1,000 for this. We talk them down to 600, and you're responsible for 5 of that because you're deductible.
Right.
Right.
So
And
we don't
that's-
even know what the actual cost, the actual value of.
Well, the actual cost has very little to do
No, I
with
know.
the bill.
So, like-
right? That's what we're saying.
Right.
Try
Yeah.
having a baby.
Oh,
Well, that'd be
Yeah.
hard for Dan.
Right?
Forget the payment.
How many people here opened their EOB after they had a baby and almost had another baby, right? Yeah, yeah. They'll charge you $15,000, $20,000 for delivering that baby, and then you see that the insurance company paid,
$2,000.
right? And then they wanna come after you. How many people here know about back billing?
What's that?
Go ahead. No, what's
Back
going on?
billing is, your insurance company may have negotiated a certain rate. Dan, make sure I'm getting this right,
All
because
right.
Dan's an expert.
Got it.
But the provider of the service may come back and say, you know what, you need to pay the rest of
Oh,
the rate.
is it balance billing?
Balance billing,
Balance billing.
yeah, I meant balance billing.
Yeah.
Wait, so
Yeah.
one more time?
So Dan comes to me
Dr. Barb.
and I do a procedure. An insurance company says to me, I'm only paying 60% of what you charge. Then I go back to Dan and say, you know what, your insurance company only paid 60%.
Give me the other
Pay
40.
the other 40. Who cares about your copay? Who cares about your deductible?
I mean, and like
So wait, so do you have-
like everything else,
Yeah.
right? This like is 1,000,000% like a it depends situation.
Yeah.
Like it depends. Like what state are you living in? What's the
Right.
law there?
Right.
Is this provider in network or out of network?
Right.
What does the law allow them to do? And it's
What is Dan's deductible? What is his individual plan? What is in his plan document? How many people know what a plan document is? All right, do you see why this is complicated?
Yeah.
This is not something where we can go, Medicare for all tomorrow.
All right, wait, before we get to the politics of it, which I'm really eager to get to, I have to ask you this. The takeaway from the woodworker story that Dan just told us, one takeaway could be that we don't need insurance at all.
That's
That
his
it's
takeaway.
such a yeah.
that's his
the
thing. He's
young
like
woodworker-
I feel a little less dumb not having insurance.
Yeah, and so what's your response to that, Dan?
I have the Jewish mother's response, which is like, no, booby, like, what if you get something, what if something happens and the guy costs $1 million, you need insurance? Like, that's not gonna work so good, yeah. Like, it might work for you this time. Like, you say, you know, you had a couple beers and you borrowed the car, and this time you didn't get into a crash. Like, next time, what the hell?
But insurance, what the woodworker is saying is that if, let's say, you had $1 million bill, your insurance wouldn't cover it anyway. So you're stuck paying the bill. You end up cutting a deal with the medical care provider, regardless of whether you have insurance.
It
So
could be
why
that-
have insurance?
It could be though that hospital too, right? It depends upon what hospital ER you go to.
That was his, that was
Right.
that was his question for me, was like, did I just get lucky that we went to
You
Swedish government?
absolutely
Yeah.
got lucky.
Yeah, so in other words, there are hospitals, it gets back to my original question, there are hospitals, you can have your thumb dangling from your hand, and the people say, I'm sorry, let it dangle. If you can't pay, you
No,
can't.
the
Well,
ER,
you can't do that, right?
the ER, it's as far as I know, every state, like ER has to see
They have
you.
to, there's a law.
Yeah, they gotta see you.
They have to see you. They can't just say, you're gonna go somewhere else.
And but this is why when the guy I hear from has like, he's like, my son had an earache. It was late. It was nighttime. I'd given him ibuprofen. Nothing's working. We're both really afraid. The ER is the only place open. We go to the ER. They're like, you got an ear infection. Here's an antibiotic. Here's a steroid. Take the swelling down. Good night. Comes back. Bill, $3,000 some dollars. Couple hundred for the doc taking your temperature and saying you got an ear infection. A few tens of dollars each for the one steroid pill and one ibuprofen or whatever, and one antibiotic. And then $3,000 is the facility fee, what the reporter Sarah Cliff calls a cover charge, just for showing up. And you know, the cover charge varies based on the intensity of the visit. There's like a scale that's placed of 1 to 5, 1 to 5. And this was tagged as a level 4. The guy I thought it was like, is level 5 when you come with your leg in a bag?
Here's a dirty little secret too about hospitals. You know, they have something called charity care, right? And all of our public hospitals get a tax break. They don't pay taxes. You know how we, if we're a business, we pay taxes, we pay utilities. Public hospitals don't do that.
They don't pay utilities?
No, they don't have to
They don't
pay
pay
utilities.
utilities?
Yeah.
ComEd
No,
doesn't
they
charge
pay
them?
ComEd, but
All
they don't
right.
pay like water.
They don't pay
pay
water.
like sewage. They don't pay like what
made a
municipalities charge.
Rom tried to undo the
Right.
charity.
And it's
Backed out of that one.
right. So the Affordable Care Act said, hey, you public hospitals, you need to start investing in the communities you live in. And every 3 years, you need to do something called the Community Health Needs Assessment and see what the healthcare needs of your community is, and you need to make those investments. They did not necessarily do that.
Yet we keep hearing about hospitals going under and
Yes.
closing.
Yeah.
Yeah.
So what's that all
What's
about?
that all about?
Well, did you hear about Dan's $3,000 bill for going to the emergency room? I think it's because we have these inflated prices, and we also have inflated wages, and we have everything about healthcare is inflated, about what to be paid for, because specialists demand a certain rate. Administrators demand a certain rate. If you're a for-profit hospital, you actually pay for people to be on your board. I mean, everybody's got their hand in the till. That adds up after a while. And so, yeah, hospitals are going under. And, you know, the thing we don't talk about is, and something came out like last week about this, you should know this at ProPublica, that hospitals,
You want to know
because of the ACA, hospitals are supposed to be more transparent about their prices. And of course, CMS said, oh, it's okay, guys. You don't have to be quite so transparent, because that's who we have in office. There's no one watching the back of the American
CMS
consumer.
is,
Oh, the Centers for Medicare and Medicaid Services.
So, all right, before we get to the politics, I just need to have a resolution of this story of the guy who took his kid to the hospital
Oh,
with
yeah.
the earache. So it's $3,500 bill. Let's say he has no insurance, all right?
He has
So-
insurance.
Oh, he has insurance, so he has to pay the $3,500?
He's got insurance. There's some deductible. He said he would call the hospital and be like, come on.
Well, if he has insurance, why didn't he go to emergency room for an earache?
Because it was 11 at night, no place else was open.
All right, so he's got the kid.
Teenager. He was
The
worried.
teenager couldn't suck it up.
I mean,
Yeah. Come on, teenager, man it up.
he said the kid was tough, and the way he was crying really worried.
All right, so in other words, he's just gonna
I'm
have
just
to.
kidding.
How much is he facing with that bill, that $3,500 bill?
I don't remember.
Okay. I was just gonna say, what would your advice be to someone with a $3,500 emergency room bill for an earache?
Well, let's say that $3,500, maybe part of that $3,500 is that his health plan charges automatically a $400 copay just for going to the emergency room. Right?
Well, which is like, to me, I'm like, because that's what my health plan is like. You got a $500. You go to the ER, that's $500. To me, I'm like, thank you, because otherwise it's like $3,500, $10,000, whatever it could possibly be.
Well, there could be more on top of that copay, though.
Oh.
You have a copay,
That
and then there are
sounds like
charges for different procedures
Just for
and
showing up.
different, right. I mean,
You're
you
not-
never know what they're doing. You get a separate charge for an MRI.
so why haven't public officials weighed in on this and said they're gonna do something?
Why haven't they, or why?
Everyone is pissed off about it. But unless you're like, you know, trying to make a name for yourself in a field of 23 candidates, people aren't really weighing in.
I have a counter question to you. Why haven't our public officials come up with something around gun control, right? It's complicated. And everybody has their hand in the till. Dan was already talking about it. How many people lose their jobs if we change 18 to 19% of our economy, right? It's not easy.
All right, look, I'll answer your question, and then you can
Okay,
answer.
okay.
At gun control, there is a large and entrenched group of voters in this country who believe they have a fundamentally, constitutionally protected, sacred right to own as many guns as they want, and they believe that any intrusion by the government on their ability to own as many guns as they want is a violation they cannot tolerate, and they will vote that way, and they will fund politicians that way. I'm looking for...
There's also,
Okay,
there's
Ben.
also an advocacy group that convinces
Right,
politicians
right.
that that is
Okay,
true,
Right.
even though they're actually in bed with the
Okay,
gun makers.
so, all right, so this is a segment of the population. Right now, I just read an article in my beloved Chicago Tribunal that told me there are people in southern Illinois who want to defect from the state of Illinois. This was just in the paper, I do not make this up, I read it yesterday. They want to defect from the state of Illinois in part because they think Governor Pritzker has gone too far in restricting their right to own as many weapons as they want. So I don't think we can underestimate the power of this group in terms of their voice
They want
in
two
the
senators
Republican.
to fight against that?
Yeah, so, yes, so what, well, I didn't say they were logical, I'm just saying it's your position.
Or that there are that many of them, but anyway.
Right,
yeah.
so, are you telling me that there is a comparable
Yes,
number of?
I'm telling
I
you.
didn't even answer the question.
All right, go ahead, but I know what you're gonna ask me.
A comparable number of voters in this country who do not want, who currently want the healthcare system that we have?
All right, there's a two-part answer to this. First, let's go to the entrenched interest. Just like with gun control, we have entrenched interest, as much, probably more money than is going into gun control of lobbyists in Washington. You've got hospital systems. You've got all of the different associations. You've got all of the different cancer centers. Even the Mayo Clinic. Man, they saved my dad's life. I love those guys, but they are an entrenched interest in keeping the system the way it is. I actually think it's more formidable than what we see going on with gun control. That's one part of your question. The second part, what's going on with the voter? Well, one thing that's going on with the voter, they got lied to. I mean, they got screwed by the promise of universal coverage, not just once, not just twice, but as Dan said, even back as long as 1918, right? So every time the voter hears, you're not gonna have to change your coverage, you're not gonna have to do this, you know, and it erodes the trust with the politicians, and it erodes the trust with the voters, and voters don't trust politicians. And I was somebody who walked all over Wisconsin, my home state, for a candidate this last round, and a farmer sat me down and said, you know, honey, I vote, which was really irritating, but he did bring me a PBR. He did bring me a beer. You know, honey, yeah, you know, honey, I voted for your people, and he meant President Obama. I voted for your people twice. But now my son is working not only at the feed store, he's running the farm, and now he's gonna have to take a job at Walmart, and he still doesn't have health care, right? So when the ACA passed, everybody said to us, don't say it's complicated. Don't say it's complicated, it's easy. Go on to the exchange, get what you need. You go on to the exchange, what do you get? You get this giant deductible that you can't even afford. Then they try to push you in these silver plans, and they say that they're controlling costs and you're gonna get a break on your copays, and every year that goes up. Every year it goes up. So the promise has not been kept, and that's part of the deal with the healthcare.
All right, so I guess we've entered the political realm of things.
I think that's what just happened.
We're about to enter the political realm.
You
Who
and
wants
your
to bring me a
people.
PBR?
All right, so here's, okay. Wow. All right, so Obamacare did not cover the expenses that people face when they have a crisis. Obamacare is expensive. Obamacare is unpredictable, okay?
No one understands it.
No, and yes, no one understands it. It was a compromise reached in order to make sure that the insurance companies did not resist an attempt to have a national care, bring them in and assure them they're gonna make their profits. We all know that's what went down, all right? The Republicans right now, their alternative is nothing. They have no plan, nothing. They've not come up with a so.
You are so sweet.
What a crowd, huh?
That's what we call care.
That's healthcare.
Thank you.
So how can
Now, there's also a chance that it could get overthrown.
Yes,
overturned,
right, as we
right?
speak,
Yeah.
Republicans in Texas are in the federal courts to try to overthrow it on the grounds that it's not constitutional. So, how can going back to your friend the farmer who gave you Pabst Blue Ribbon, how can he believe that voting for a Republican, or why would he believe how nihilistic it is? He doesn't like the one plan that exists, so he's gonna vote for a party that offers nothing in return other than taking away the crummy plan that he has. That makes no political sense at all to me.
Well,
That almost sounds strangely close to the Mick Donkey theory.
Yes, you
Yeah.
can steal it and call it your own. So, you know, yeah, it is the McDonkey theory. You gotta give somebody something. You gave them something with Obamacare. Okay, it's not great, but no, all you wanna do is take it away and give them
so
nothing.
the big theory that the Democratic Party had is once you give people something,
Yes.
it will be hard to take it away.
Yes.
And so let's just pass it, let's just jam it through, let's just get it done. Well, what they didn't count on is the courts. You know, they did not count on it getting to the Supreme Court, and they definitely did not count on stacking of the Supreme Court like we have now. And so their theory is blown up. This thing could go down with the Texas case, and we're gonna see women now being discriminated against because they're women and they can have children. We're gonna see anybody who had a pre-existing condition see their premiums go up, and maybe
If they can get insurance.
if they can get insurance at all. And then maybe the voter's gonna say, oh yeah, that Obamacare thing, that wasn't so bad. I can't believe maybe we need to go back to that. But right now, all they remember is, hey, the president went on TV and he said, if you like what you got, you can keep it. And guess what? I liked what I had, and I couldn't keep it because I couldn't keep paying that premium, or I couldn't keep paying that deductible. Or even worse, I couldn't keep it because my employer now had to deliver health care to me, and they didn't have to in the past, and they kind of delivered a shitty plan. You know, and now I'm in a high deductible health plan. And even worse, I'm in a high deductible health plan, and they tell me it's a $5,000 deductible, but then when I read the fine print, it's more than a $5,000 deductible, and each of us has our own deductible, me, my spouse, and my 2 kids. It's complicated, and that's where I think the voters at. I think the voters are saying, this thing got effed up after Obamacare, not remembering how effed up it was before Obamacare. And I think these voters also are scared. They're scared. And so we're just gonna throw that spaghetti against the wall.
I mean, I got a question, like, what's the, I mean, I don't, like, 2 years ago, right, we had this fight in Congress, where there was a bill, Republican bills, like, let's trash Obamacare, get rid of it. And then, there was I remember seeing all the headlines, like, public opinion shows, like, people hate that sucks.
Right.
So, what I'm hearing from you is like, nah, people are ready to get rid of it, but like, I don't know, like, is that true?
I don't know. You know, I say yes, that's true, and then I go and I walk, you know, the farms, you know, I'm going back to my classroom now, I'll probably hear more, but I think, well, so talking politics, one thing I wish wasn't happening with the Democrats is Medicare for all.
All right,
I'm just
let's
gonna
get-
go there.
Go ahead.
I'm just gonna go there.
Go, come on.
Because Medicare for All, I feel, is basically telling the American voter another fib. Because we can't get to Medicare for all.
Not quite a lie.
Not
but
quite a
fib.
lie, but a fib. And Medicare's not that great, you guys. It's not that great. Who here has Medicare? Right. Medicare's. Okay, you love it. You must be healthy. What is your supplemental plan? What do you pay? Do you have a supplemental that you, because you know, with Medicare, you have to have a supplemental plan. Right. You know, I don't want to go into my own personal story with my dad, but you know what? He got in the wrong Medicare supplemental. He got in an Advantage plan.
Oh.
Yeah. Well, he didn't know because Jane, his friend for 50 years, sold it to him, right? And so my dad ends up with a terminal disease, and it pays nothing. Wrap around, and I've got him at the Mayo Clinic. So I'm having to get him in another plan. I'm having to do, and I know Medicare. The other thing, talking about seniors paying their bills with Medicare, oh my God. You have to read your explanation of benefits and your bills every month from Medicare, because the hospital or the physician will charge you more than the Medicare rate. And if Medicare goes back and reviews that bill, they will deny the bill even after you've paid it. And then the hospital will come back to you and say, well, Medicare denied this, you need to pay this, even though it happened 6 months ago. So Medicare sucks. I mean, it's really not the model we should be looking at. And it's a lie.
And that's your fundamental problem with these, the Democrats, what they're talking about with Medicare for all, or the light versions of these things.
Yeah, my fundamental problem is, let me just, setting aside that Medicare, I don't believe is the right vehicle, setting that aside. I don't believe it's telling the American voter the truth. Telling them that you're gonna get Medicare for all during my 4 years is not the truth. It is not the truth.
Well, I mean,
And we've talked about
Yeah, I
this.
mean, I do that, like, you know, talking with you, Ben, was the first time I was like doing the math. I was like, so Ben, like, you're saying this is a progressive country, everybody wants this. When you get it, I'm like, okay, well, let's do the math, let's give you everything. Everything Ben Jarabsky's dreams to say. It's January 2021, and President Sanders or President Warren is getting sworn in.
First thing he does, no tips in Chicago.
And that president has a massive Democratic wave behind them. The House is solid blue. The Senate is solid filibuster-proof blue. And you're already, and again, you're already like, sure, yeah. And they get it together and pass the plan of your dreams that even Barbara Otto's gonna say it's gonna work in the first 100 days. The first 100 days. Well, now it's like April, May 2021. And all the hospitals and all the insurance companies.
Wait, you missed a step. They have to promulgate rules.
Well,
Then the hospitals.
Well, no, but at that moment, all the hospitals, and by then already, the day the legislation passes, all the hospitals and all the insurance have already locked in 2022. Because this is the fifth of the economy. You can't plan a fifth of the economy.
Say what you mean
on a
by
dime.
locked in. They locked in.
They've made their deals. They've said,
made their deals
Dr.
with
Otto,
providers, right.
this is what we're gonna pay, this is what we're gonna reimburse on your plan. From our plan, this is what you're gonna get paid, this is how it's gonna work, are you in our network or not? You've said yes or you've said no, right? Because I'm the insurance company, like, I gotta get all this stuff straight so I can submit it to the state regulators, so they can approve my plan over the summer, so I can offer it, I can show employers what I got in the early fall, so they can show it to their employees in the late fall to do open enrollment. By April, by May, that's all happened. 2022 is over. Okay, great. So let's say in the greatest feat in history, in like a World War II style mobilization, rules are promulgated and the economy is completely turned around like a battleship on hyperdrive. You know, before a year passes, like faster than any of us can imagine it. And so that means that Medicare for All takes effect in this crazy scenario in January 2023. And this is like if I went to Las Vegas and I'd said, I'd like to play a bet that this will happen. The odds would have many zeros, right? There would just be a lot of zeros. And that's 2023. That feels like in a country where 45% of people say a major medical event would send them into bankruptcy. 2023 seems like a long, where most people have more zeros in their deductible than they do in their net worth, right? 2023 is a very long way away. And this is, again, a scenario that nobody believes will ever happen. So when you say, like, it's a fib, it's like, yeah, I mean, by 2023, the 2024 election is well underway, right?
And it's been well documented because I have a theory named after me. I'm skeptical of this whole thing, but you know, nothing is ever going to change if you don't
Give it a
set
shot.
some sort of goal.
Sure.
If you don't set. So what should they be doing? And I mean, what else should they say?
What they should
could
be
do?
saying is, well, we have the Affordable Care Act, we have these protections you love, let's expand on those. Some are talking about state plan options, right? And I think a lot about Medicaid as a place to start from. Medicaid, in 42 states, we have something called a Medicaid buy-in. Medicaid buy-ins were specifically created for people with chronic healthcare conditions who have earnings and have assets. So they weren't poor enough to be on Medicaid, but they had these chronic conditions, and we wanted to keep them in the workplace. And so we created these Medicaid buy-ins. And that is something that states could be doing now. New Mexico's been looking at it, Vermont's been looking at it, Pritzker's been thinking about it. We could create a state plan option. We already have a pretty big Medicaid program in the state.
So you're saying Medicaid for all?
Medicaid state plan option.
Okay.
Medicaid, you get in the back door, you start doing it state by state, and
You're
then
saying
let's
nothing
see.
for all.
Nothing for
I mean,
all.
Nothing specific prescribed for all.
Yeah.
Well, Medicaid for, all these programs, really, the point of like a Medicare for all or a Medicaid for all is to reassure people that their bills will be paid. Their health services that they need to stay alive or to have their finger put back on will be paid for. And I think Bernie, knowing people the way I do, Medicare is for everybody. It's universal. So it's like Social Security. Medicaid is for poor people. And so a lot of people are like, oh, it's for poor people, it's gonna be inadequate. I don't want anything to do with Medicaid, but I'll take Medicare. And I'm listening to you right now, and the reality of what you're saying is that, forget the name,
Yeah.
Medicaid does more of what you want from a health plan, which is to cover your bills.
Yeah.
So Bernie should be saying Medicaid.
So change Medicaid, the Medicaid expansion thing, give it a new name, call it Medi-Call or something.
Yeah.
I don't know.
I mean,
you know?
look.
Like it's about
You want to work with the name, keep it.
Right,
Yeah.
right. We supposedly have all these fabulous pollsters working with all these politicians and working with the Democratic Party. You would think that we could go out there and we could say, yeah, we could create this national plan, this national option. You could choose to be a part of it. Small businesses could choose to be a part of it. They could buy in and you could be a
All
part
right,
of
let
it.
me ask you this, Barbara.
'Cause they
Let's
do
go
it
back
with
to
Medicaid
that,
now.
let's go back to that debate that we've had the last two debates. And we have a split in the Democratic Party. And you have Bernie and Elizabeth, but mainly Bernie, saying Medicare for all. We have to take the insurance companies out of the equation. That's all there is to it. And if everybody comes together, we can do it. Don't say we can't do it, we can do it. And then you have a whole group of them on the fringe, Delaney, et cetera, saying, you're telling people you're taking their private insurance away. They love their private insurance. Let them keep their private insurance. It's how do you get that divide? How do you bridge that divide? I cannot see the Democrats going into a convention in your home state, Milwaukee, I might add, with cheeseheads. How are you going to have a Democratic Party come out of a convention, once again, where you have a faction that says we need to keep private insurance in here, and you have a faction that says we absolutely have to get the private insurance out of here?
You like to ask the really hard questions.
That's what he said.
Right. Look, how do we ever make change in this country, right? I hate to say it because when I was a young gun working on single payer health care, I called them incrementalists. God, it's a dirty word. But that's how you really make change. I mean, I feel that a Democrat could come in and they could talk about this great plan, which is really a national Medicaid buy-in, that everyone could choose to participate in, right? And let's be honest about Medicaid. Who delivers Medicaid? The state is really just a payer. There are small health, Medicaid managed care organizations delivering the care. They're the intermediaries, right? So I think if you offer a national plan, you structure rates in such a way like we do with Medicare, that is the good thing about Medicare, right? We've got a Medicare rate. And if we do structure it in such a way that people can participate and they can choose, small businesses can choose, I think you start creating momentum and you get beyond that nationalized healthcare scare. Because just like in Saskatchewan, and I know everybody's going to be like, no, don't talk about Canada. But just like with Saskatchewan, you're going to have success.
Wait, what happened in Saskatchewan?
Saskatchewan started, Canadian Universal Healthcare Program. They felt they went first to a statewide or a province-wide plan.
Cool.
Yeah.
Well, that explanation is not really gonna fit on a bumper sticker.
No, it doesn't. And this is the problem with politics and healthcare. It doesn't fit on a bumper sticker.
I don't even think it fits on a t-shirt.
I'm with the Saskatchewan plan. All right, we're gonna take some questions from the audience. I'll be the mic passing guy.
That's it.
Bird, I saw your hand first.
Okay, first of all, Mick, what exactly is your theorem?
You have to talk about it now.
Oh.
No, I have talked about it.
So this is how I understood it,
Yeah.
is this, right? You're kind of putting it forward as like, it's like, let's make a deal. You can keep your health plan, or you can have what's behind door number 2. Is that right? I mean,
No,
like,
it's not, mine is simply a political campaign thing where it's poisonous to go tell people you're gonna give them some sort of plan that takes something away
if
from
you
them.
vote, you can keep your health plan, or you can vote for me and get whatever the fuck's behind door number 2.
Makes sense.
Yeah, like,
I tell somebody you're gonna take something away from them.
This is what I think is
Never.
the fatal flaw with the Medicare for All plan, is to come to all of you and say, even if you want better insurance, or you need some insurance versus the nothing you have, or you sympathize with people who have no insurance, to say that part of the solution is to take away everything you see or know now and give you something you've never seen, or that you have skepticism about, a government-run health plan, I think is a terrible idea. I think that it should be, what you should stress on the campaign trail is various forms of expanding healthcare options, rather than saying I'm going to take something away and then what I'm going to replace it with is going to be great. Expand, not replace.
Or even not tell people you're taking something away. Right? Which is kind of what happened.
You're saying like a fib, Barb?
Yeah.
But Trump, just like John Delaney and Tim Ryan and John Hickenlooper, yes, man, I really go down the line, are going to say Bernie's taking something away. You can guarantee that whoever the Republican nominee is, and I think it's going to be Donald John Trump, will say he's taking it away.
Yeah, which brings me to exactly my question. The reason people started calling it, the Democrats and everybody started calling it Medicare for All, was because originally it was the single payer plan, which was deemed socialist, which makes that, so it makes single payer a non-starter. But then when you come to Medicare, that in and of itself, the way it's been proposed with the taking away your private insurance, it's also a non-starter. But what I don't understand is how they can even propose something like that, because Medicare, by definition, will only cover 80% of your costs.
Right, right.
And the other 20% is automatically out of pocket.
Right.
It's a supplemental.
Right.
Or insurance.
Right.
So how could they even propose?
How can they even propose
wiping
it?
out that 20% of your
You
supplemental?
have now hit on what I ask every time I sit through a debate. Every time I read, are you kidding me? Medicare for all? I say that all the time. Look, I think there was some polling somewhere, and I also know when I sit and talk with my friend who likes to give me PDR, and talk politics, everybody has Medicare, everybody has some experience with it, and everybody remembers the battle times, at least at this point, of when people didn't have
But you still
access.
need a private insurance company to cover the
I
other
know,
20%.
I know, but people, and again, getting back to it's complicated. Is Bernie gonna say that when he's got like 30 seconds to respond to the question that Jake Tapper is asking, right? I think it's very, this is the other problem with healthcare. It's very hard to say it in a salient soundbite, right? It's very hard to say it in a salient soundbite because it means something different to so many different people.
How about just plain old Medicare for all, and it'll cover your 80%, and yes, you will need another insurance company for your other 20%.
And DJT, Donald J. Trump will say, "Oh my God." Right? It's so complicated. Right.
Yeah. No,
With
I
lots
agree.
of exclamation
Yeah.
points.
I'm sorry.
DJT.
Hi, so I have a question about the public option. And so like Medicare for all or Medicaid for all, whatever the case may be, if we make it a public option, how do we make sure that it's sustainable over the long run? How do we make sure that it's not just getting filled with a bunch of people who are getting benefits without paying in? So it's actually
So-
working like a real insurance.
Sure, let's talk about Medicaid buy-in programs that exist right now for people with chronic conditions. Medicaid buy-in programs work just like this. States have a special provision under Title 19, which is the technical area under the Social Security Act around Medicare, where they can lift income and they can lift asset restrictions. Right now, because Medicaid is means tested, which means it's a welfare program, you can only have so much income, you can only have so many assets. States can lift that income and asset on their own. They can change it in their state plan that they get the federal government to approve. And right now, people are able to pay a premium, just like you would to a private health plan, to participate in Medicaid, and that's how it becomes sustainable. People pay a premium just as they would in any other health plan.
Thank you.
That's a good question. Yeah, full disclosure, I know those people. I
So Medicare for All is a shorthand version of expanded Medicare. And I have never had any problem with Medicare. I love Medicare. I think a lot of people here might say that. Certainly a lot of people I know that look like me would say that. And it's an incremental, you know, you go down to 63, and then you go down to 62, and you go down to 61 until everybody is in Medicare. And it doesn't deny the private insurance companies because of the supplemental. I mean, it just doesn't seem that complicated to me as, you know, kind of this group. I think if that table were on Medicare, the conversation might be different, even though you've had your own bad experience.
Yeah, I don't know, but Medicare doesn't cover long-term care. If I need long-term care, meaning if I need somebody to come in and I have a chronic condition, just until recent, I mean, Medicare really doesn't do a very good job with prescription drugs. We have Medicare Part D, but frankly, if you need prescription drugs, it's still expensive. We still have these donut holes that people fall in. So I'm not saying it's horrible, right? It's better than nothing, but I think Medicaid is better. Medicaid is better. It's a better place, a better foundation to expand to the general population.
So I'm asking a question as a Medicare recipient. I believe that you're all kind of skewing this discussion extremely far to the right. First of all, I don't care about the insurance companies. I don't care about all the jobs that you claim are going to be lost. I want to get rid of the insurance companies, and I want to look at the world. Look at Germany, look at France, look at England, look at Canada. Why are we paying 5 to 10 times the amount for our medical care than any of these other countries that have universal health care?
I mean,
And,
sorry.
Without comparable results.
well, go ahead.
Well, I mean, I think the answer, the one-word answer, right, is capitalism.
That's right, we follow the dollar.
That this is, that we have, yeah, no, I'm certainly not here defending, I'm not here to fight for the jobs of the people whose jobs would be lost if that, I only brought that up to say, like, that's how big the, a transformation we're talking about.
It's not.
And it's emblematic of how much, of exactly what you're talking about, of like, we are spending when we spend our dollars on paying medical bills and on paying health insurance premiums, we are spending them to employ those people who
That's
are not providing care.
The other issue is we have a lot of unemployed people, right? 44 million, 48 million I hear, who don't have insurance because our insurance is linked to our jobs. I worked for 50 years and I had insurance. And then when I lost my insurance, I went on to Medicare immediately. And within 4 months, I had a major medical issue. And I had Medicare. Thank God I had Medicare. Why are we ignoring all of the unemployed people who don't have insurance plans because they don't have an employer or are not self-employed? That's a big gap in our society, and that's what we're not talking about.
They should be on the Medicaid expansion plan. That's
Well, if
exactly
they
what we
are-
have in Illinois.
If they are or not. I'm just talking about a national program.
Sure.
I don't want to look at state by state because you know how unfair that's going to be for anyone who's in a very poor state, Mississippi or Louisiana, Alabama versus Washington State or Vermont or New York State. So we have a lot of discrepancies here that are not that complicated. And if we create one template for our insurance coverage, for medical insurance, national coverage, I think we're in a much healthier groove for the future. And I hope for my grandchildren and for all of your grandchildren and great-grandchildren, we'll have a healthier society. Because right now, I'm not pleased with what I see.
Well, I disagree with you only, in not in necessarily what I want versus what you want, only in what I think the electorate will accept at this point in time. And you're shaking your head, but let me finish, at least finish what I'm saying. I just don't think that people don't, I agree, nobody likes, people who have health care, nobody likes what they have. But I just don't think they're gonna sign on to get rid of it for something that they haven't seen and don't know what's coming. Why would anyone do that? It doesn't make any sense, honestly.
But it does.
But what we're debating here is exactly how to expand it to more people. Agree with you, so.
Well, it's even beyond that. I mean, to follow up what Mick says, I'll repeat what I said. We're so far removed from where the ideal that you just articulated very well. And we're now, think about this. You have one party that's debating over the particular type of healthcare policy they want. And they're like gouging each other if they don't go too far to the left, or they go too far to the right, etc. You have the other party that their plan is to destroy all healthcare. And it's neck and neck in the polls. So I try to be as idealistic as I can. You know, even after 30 years of fighting Chicago Democrats, we usually losing, I still try to be idealistic. But this one is really difficult for me to take. I cannot understand why the Democrats are not destroying the Republicans in the polls when one party offers you nothing. I mean, this is the McDumpy theory. You would figure it would work. One party is offering you negative. We're going to take away everything you have. And the other party is squabbling over the details of what they're going to give you. You would think that the party that is offering the American people something would be way ahead. Instead, we're like, I don't know, worried about Wisconsin swing voters and the farmers. So I don't really know what to say other than I don't think Chicago voters are as the most irrational voters in the world like I used to. I think American voters as a whole have got to beat. That's pretty much all I can say.
I will also say this, well, first of all, I've never been called conservative, and so that one hurt. But this is a political, came prepared to talk about the politics of healthcare. If I were talking just simply from a policy perspective, I might also have the same response to you, which is maybe we shouldn't call it Medicare or Medicaid, maybe we should call it a public option. I think the reason why we call it Medicare is because pollsters somewhere said that people feel comfortable with Medicare.
It's less socialistic
It's
than
less
single payer.
socialistic than single payer, but I don't believe that we can, within 4 years, move towards anything more than a state plan, or I would love if we could move towards at least a national option where people could pay in and they could choose to do that as opposed to sign on to their employer coverage.
Maybe they should call it a congressional health plan and more people.
Oh, shit.
Next question.
Yeah, unfortunately, I'm gonna ask the opposite question, which is, I'm concerned about the political capital for all these solutions. I don't think the electorate has that much control over what happens in Congress, and I think the health insurers and the industry have a lot of control. These solutions that you're discussing aren't gonna destroy private health insurers, but I think they're gonna piss them off. So I'm wondering, like, where do you see solutions where the health insurance lobbyists don't wreck this? And or how do we prevent them from wrecking this? But more the former, I think, if you're cynical. As I am.
I don't know why anybody's looking at me, yeah.
I don't know what the this is that they're gonna wreck, because,
Pick a
It's
plan.
already been.
I mean, pick any of it.
yeah, I
Any
mean, if you view the Democrats' inability to agree on a strategy as evidence of wreckage, then I think the wreckage has already been done. When you have, what was old boy's name, the congressman, Delaney, getting up there and, at a debate.
There's a lot of old boys in this race.
Getting up there, at the debate and challenging Bernie on just the theme of universal coverage, like we can't afford it, people don't want it. When you get Tim Ryan from Ohio saying that he's against universal coverage because he's standing up for the unions in his state who've negotiated, that's a level of cynicism beyond Rahm Emanuel. And I never thought I'd say
that's
that.
heavy.
Yeah,
That's
that's so it's already been destroyed. And the Mick theorem is so true. It's like I saw it through it in '93 with the Clintons, with the insurance companies, with the couple. This is before your time.
Mary and Louise?
Yeah, all right. You know, and
That was my commercial.
Yeah.
I got Ann Mira and Jerry Stiller to do a knockoff. Anybody remember that?
Yeah, I did remember.
Yeah, I did that. Single payer across the nation.
Wow.
It was a really great commercial.
Yeah, man. So anyway, I hate to be cynical. I mean, just overly pessimistic, but I do believe the damage has already been done in terms of poisoning the public on.
How much of this question, though, I mean, how much is any of this an independent variable, right? I mean, earlier, the top of the evening, you asked me, why don't we have gun control?
Right,
Right? To what extent is that like, I mean, I don't think that's just rhetorical.
right.
I mean, right, I feel like, okay, I'm just gonna be the person who says this in this conversation, but like, right, we've become political tribes, right? People have tribal identities, and that opposition to gun control and opposition to any government to anything that that Barack Obama ever put forward, including Obamacare, opposition to any government involvement in our public life, and a bunch of other things, right? Opposition to racism in any kind, like if you want to put it in certain ways, like all of it's wrapped up in one identity, right? And so when you talk about Republicans and Democrats being neck and neck in the polls, or you know which way the Senate will go, I mean, I don't think that I mean, again, like I'm the last person to talk about any of this, but like I don't know anything, but you know.
No, that's not true. You just don't want to say it. There's a big difference between knowing something and not wanting to say it.
None of us know anything. But I think you know the question of like, like, they're separating the kind of ideal policy from kind of what the politics are and what people will buy, but the question of like, what the electorate will do, your skepticism, your cynicism, your despair about, our electorate, I have a hard time separating out the question of like how people respond to a particular healthcare proposal from how they would respond to gun control is the question of the day, right? Yeah.
I think there's a lot of parallels into them, and when I hear more and more, when I hear like people talk about what Bernie says we need a revolution, to me, like the revolution has to be something like get rid of the Electoral College. I mean, change the way we populate the Senate. I mean, I just feel as though the situation is stacked. When we tolerate the fact, how many votes did Hillary Clinton beat him by? 3 million? 3 million votes.
Yeah.
And now, the fella from the New York Times wrote the article, Cohn, saying, well, whoever the Democratic candidate is, Mick Dumpke runs, he's going to beat Trump more than Hillary Clinton did, but it doesn't matter because according to his little algorithms, Wisconsin, Michigan, and Pennsylvania are still going to go to Trump. That's wow. That's,
All right, we've got more than a year.
we got to do some of the knowledge, man.
That's an attorney in politics. We have a question over here. If you pass the mic over, please, this way. Get at least one, maybe two more questions, depending on how much we.
So taking a totally different tack here for a second, I think, like, I want to know what you all think about efforts around like fee for service, medical practices, and like the end runs that people are trying to do sort of low to the ground around like how do we do cost control. And there's actually some medical folks who want to do this. I mean, I read like, the folks who are trying to figure out how to maintain financial independence in this crazy capitalist system. And there's a lot of interest in this, at least in a certain segment of the population. So I'm kind of curious, like, how does that work in the policy sphere?
I don't know.
I love it. Dan.
Well, I don't know about policy,
Okay.
but I know I get a lot of emails from people who listen to the show, and one of the big stacks is from people like, oh, you got to talk about direct primary care,
Right.
Yeah.
which I think is what you're referring to, which
Yeah.
is where like, I'm a doctor. Here's our deal. You pay me. I got a fee. It's X a month. It's no insurance. You just pay me straight. You got my cell phone number. Come in anytime you want. I do anything for you that
It's
I
like
can.
concierge.
But except instead of this is what it used to be called, except now it's kind of called direct primary care, and we're gonna take care of you. We're gonna do all the things. My response to that is the same as my response to the guy who's like, I can't afford health insurance. I'm like, Booby, what happens if you get the cancer? Your direct primary care doctor can't do anything. You need health insurance. Like that's because the direct primary care doctor's not gonna do anything for you. So that's my.
Because specialists aren't doing it. They're not doing that's a big piece of it.
Yeah.
I mean, Dan and I were talking about this earlier, the DIY healthcare hacks. How many here know Dr. Google? Right?
Take a while to figure that out.
I gotta tell you, I do this. I do healthcare for a living. I advise people on things. I advise Congress. My tongue was purple after a jog, and I looked in the mirror and I'm like, I got a purple tongue. I'm gonna look on Google. And when I Google told me you have a vascular problem and you could be having a heart attack. And I said, yeah, but I'm not quite feeling that bad. I'm gonna go to work. I sent a message via my chart and a picture of my tongue to my primary care physician, and I'm getting these calls, and I'm in a meeting, and they're like 5 calls in a row, and it's like, for the love of God, go to the emergency room, you're gonna drop dead tomorrow. So I think a lot of people are moving towards not just the direct thing, but they're also their own doctor. And I think that's a good thing and a bad thing, right? I think it's a good thing because I think today, compared to when I was doing, Harry and Louise with Ann Mura and Ben Stiller, people weren't cognizant of taking care of their health. They weren't thinking about preventive care. They weren't thinking about healthier lifestyles. Now we're there. I think that is a great thing about Obamacare. The one thing we never talk about with Obamacare is the fact that preventive care is free. You know, that you, especially with Medicare, big issue. A lot of people, older adults, weren't getting their preventive care. So I think, though, there's this DIY movement that we need to be on top of. And Dan, actually, an arm and a leg, has a great podcast around insulin and around how people are starting to make their own medications, right? Yeah.
There's a group of biohackers in Oakland
Right.
who've been working for several years on synthesizing DIY insulin they want to make open source and distribute the method.
It's scary, but interesting.
Right,
Yeah.
right. I mean, and who knows? Like, who knows how it'll go? This other person that I talked to has made a DIY artificial pancreas. She wrote me a note at the end of the person saying, I'm part of a movement. And basically they pack, there's like insulin pumps and there's glucose monitors. And so these people wrote software to like tie it together so that she can kind of program the pump to kind of keep her blood sugar just where she wants it. And in the years since she and her cohorts in this movement created this thing, Medtronic has come out with a pump that does many of these things. It's very expensive. And her doctor keeps saying, sure you don't want to switch? And she keeps saying, no, mine's better. Mine's better.
So this is what I think is going to disrupt healthcare, because let's face it, capitalism rules, right? And disruption like DIY healthcare is what is going to change what we're charging, what we're doing, and that I think is a huge thing that we can't discount.
I think that's a great place to wrap up. Well, thanks so much, Barb and Dan. Great discussion. Thank you both for being here. And thanks to all of you for coming on a beautiful summer night, for your questions, for your criticism. We like that too.
For the PBR.
Next, we already figured out this is unbelievable, a moment in First Tuesday. We actually figure out what we're going to do for next September. Today we solved healthcare. September, which prom?
We'll be talking solving immigration.
Oh, immigration. That's easy. All right. Just
Make sure you don't want to do gun control while you're at it.
Yeah. We'll get to it. All right. We'll see you all next month. Thanks a lot.